Welcome to today's lecture on endocrinology. In this session, we will explore various topics related to the fascinating field of endocrine regulation and its impact on digestive function and metabolism. Specifically, we will delve into the effects of different hormones on appetite regulation, glucose homeostasis, digestive function, and the management of various digestive disorders. So let's dive right in. Ghrelin and leptin are two important hormones involved in appetite regulation. Ghrelin, primarily secreted by the stomach, is known as the hunger hormone as it stimulates appetite. Leptin, on the other hand, is produced by adipose tissue and acts as a satiety hormone, signaling fullness to the brain. In individuals with obesity, there is often an imbalance in the levels of these hormones. Increased ghrelin secretion and decreased leptin levels contribute to excessive appetite and reduced satiety, leading to overeating and weight gain. Understanding the intricate interplay between ghrelin and leptin can aid in developing targeted therapies for obesity. Gastric inhibitory polypeptide, GIP, is a gut hormone released after a meal, primarily in response to the ingestion of carbohydrates and fats. GIP functions to regulate postprandial glucose levels by stimulating insulin release from pancreatic beta cells and inhibiting glucagon secretion. In individuals with impaired GIP function, such as those with type 2 diabetes, there is reduced insulin secretion and impaired glucose regulation. Developing a deeper understanding of the mechanisms underlying GIP secretion and its interaction with insulin can contribute to the development of novel therapies for diabetes management. Insulin resistance is a fundamental characteristic of type 2 diabetes and is closely linked to digestive hormonal dysregulation. Several factors, including chronic inflammation, abnormal adipokine secretion, and altered gut hormone signaling, contribute to the development of insulin resistance. Studying the intricate molecular mechanisms underlying insulin resistance in the context of digestive hormonal dysregulation can provide valuable insights into potential targets for therapeutic interventions. By addressing the underlying hormonal imbalances, it may be possible to improve insulin sensitivity and glucose homeostasis in individuals with diabetes. The gut microbiota, consisting of trillions of microorganisms residing in the gastrointestinal tract, plays a vital role in various physiological processes, including hormone secretion. Emerging evidence suggests that gut microbiota can influence the function of enteroendocrine cells, which are responsible for the production and release of hormones involved in appetite regulation and glucose metabolism. Understanding the complex interactions between gut microbiota and enteroendocrine cell function can potentially uncover new therapeutic avenues for managing metabolic disorders, such as obesity and diabetes. Hormone-secreting gastrointestinal tumors, such as gastrinomas and insulinomas, can lead to excessive hormone production and subsequent metabolic dysregulation. Somatostatin analogs, synthetic compounds mimicking the actions of the hormone somatostatin, have proven to be effective in controlling hormone secretion and symptoms in these tumors. By inhibiting hormone release from these tumors, somatostatin analogs alleviate the associated complications, including hypergastrinemia and hypoglycemia. Research on the mechanisms and clinical applications of somatostatin analogs is crucial for improving the management of hormone-secreting gastrointestinal tumors. Carbohydrate metabolism is tightly regulated by numerous hormones, including insulin, glucagon, and growth hormone. The balance between these hormones is vital for maintaining glucose homeostasis. Disorders such as diabetes mellitus pose a significant threat to glucose regulation, as they involve insulin deficiency or reduced insulin sensitivity. Comprehensive understanding of the hormonal regulation of glucose metabolism, along with the pathological alterations in these regulatory mechanisms, is essential for effective therapeutic interventions and management. Sex hormones, including estrogen and progesterone, play a crucial role in modulating various aspects of gastrointestinal function. These hormones can influence gut motility, nutrient absorption, and mucosal integrity. Moreover, the use of hormonal contraceptives, such as oral contraceptives or hormonal intrauterine devices, IUDs, can have implications for digestive function. Understanding the interplay between sex hormones and the gastrointestinal system can aid in managing digestive disorders that exhibit gender differences in prevalence and symptomatology. Pancreatic exocrine function, responsible for the production and secretion of digestive enzymes, is tightly regulated by various hormones. Cholecystokinin, CCK, and secretin are two important gastrointestinal hormones involved in the regulation of pancreatic exocrine secretion. CCK, released in response to the presence of food in the duodenum, stimulates the release of digestive enzymes from pancreatic acinar cells. Secretin, on the other hand, promotes pancreatic bicarbonate secretion, aiding in the neutralization of gastric acid in the small intestine. Understanding the mechanisms and functions of these hormones in pancreas regulation is crucial for managing exocrine pancreatic disorders. Thyroid hormones, primarily triiodothyronine, T3, and thyroxine, T4, have a significant impact on gastrointestinal motility and nutrient absorption. Hyperthyroidism, characterized by excessive thyroid hormone production, can lead to increased gut motility, resulting in diarrhea and malabsorption of nutrients. Conversely, hypothyroidism, characterized by decreased thyroid hormone levels, can cause decreased gut motility, leading to constipation and impaired nutrient absorption. Consequently, understanding the influence of thyroid hormones on gastrointestinal function is crucial for diagnosing and managing thyroid-related digestive disorders. Neuropeptide Y, NPY, a neurotransmitter primarily found in the central and peripheral nervous systems, exerts profound effects on various aspects of digestive function. NPY influences gastrointestinal motility, bile acid secretion, pancreatic function, and appetite regulation. Understanding the intricate molecular mechanisms underlying the effects of NPY on digestive function can pave the way for novel therapeutic approaches in managing digestive disorders and metabolic dysfunction associated with abnormal NPY signaling. Glucagon-like peptide 1, GLP-1, agonists, a class of medications used in the treatment of type 2 diabetes and obesity, have gained substantial attention in recent years. GLP-1 is an incretin hormone secreted by the intestines in response to nutrient intake, stimulating insulin secretion, suppressing glucagon release, and promoting satiety. GLP-1 agonists, which mimic the actions of endogenous GLP-1, have demonstrated efficacy in improving glycemic control, promoting weight loss, and reducing cardiovascular risk factors. Exploring the role of GLP-1 agonists in the management of type 2 diabetes and obesity is crucial for optimizing treatment strategies. Gut hormones, including glucagon-like peptide 2, GLP-2, and peptide G, PYY, have recently emerged as potential therapeutic targets for digestive disorders, particularly inflammatory bowel disease, IBD. These hormones play crucial roles in regulating gut integrity, mucosal healing, and inflammation. By modulating the secretion and signaling of these gut hormones, it may be possible to develop targeted therapies for IBD, minimizing inflammation and promoting mucosal healing. In-depth exploration of the emerging field of gut hormones can yield novel treatment modalities for various digestive disorders. In conclusion, endocrine regulation significantly impacts various aspects of digestive function and metabolism. From appetite regulation to glucose homeostasis, numerous hormones and their intricate interplay contribute to maintaining physiological balance. By comprehensively understanding the mechanisms underlying hormonal dysregulation and its impact on digestive disorders, we can pave the way for innovative therapeutic interventions. Further research and exploration in this field hold immense potential for improving patient care and management outcomes in the realm of endocrinology and digestive health. Thank you for your attention, and see you in the next lecture.